I get a lot of questions through my website, and I go through those with Barbara. So if you'd like to kick off with the first question today.
Okay, Dr. Sibthorpe. Our first question is from Tess. I'm 44 years old and noticed I have pronounced nasolabial folds. I have been doing some research but would like to know what treatments you recommend.
So nasolabial folds are probably one of the most searched treatments, if you like, probably because it's one of the first things we see as we get older. You get these folds here as a result of tissue descent and deflation of the mid-face. So it's one of the common things that I do in my practice. So there's a variety of ways of treating that, but the essential way to treat it is to treat the cause. So rather than putting fillers in here, which some people still do and shouldn't, you want to be looking to treat up here where the cause has originated from, and you really want to be lifting the tissue. So there are different ways of doing that depending again on someone's assessment. But the simplest way is to do a sort of 5 or 8 point modified lift, and you'll be using fillers that are volume based. They're used for sculpting or lifting. And you're going to place them along this arch here to give that lift. And you can use some fillers here in the deep plane if you're getting some very large folds, particularly as we get older, we lose some bone loss. The other things you can use now is some of the new regenerative or the biostimulators, and new things like sculpture or harmonica, where we're looking to stimulate our body's ability to make collagen or to make fat. And these are placed, again, fairly similar positions in the med face, really just to design to give some lift. And that's how one of the best ways of treating a nasolabial fold is.
Is it the same when you inject women or men?
Yes, because there's a difference between female and male shapes. It's very important to realize that. You may see, as I've seen, some of these celebrities, male, being treated with a standard female approach, so they end up with big cheeks and more feminization. Men generally have a much squarer face. They tend to have more angles. So really, when you're treating this nasolabial fold, you don't really want to create too much of a cheek for them, where the females have this much more rosy, fuller cheek up here. So our injections tend to be more medial or central with a male, and not really up here, which would give them more of a cheek or a rosy type cheek. So there are differences in the male-female with the jaw, the mouth, the nose, everything. So all of these considerations, they have to be taken, you have to take these into consideration, especially when you're planning to treat the two sexes. They're very different.
Do you have a lot of male clients complaining about nasolabial folds?
I think I do get more males now coming to my clinics, and usually they are looking at this tear trough area for them is a common one. Very few of them too are not really worried about the folds, I find, but they may start to lose volume in the deep plane, the face here. Men generally get a little bit more concerned about the jawline and the contour and the strength of the chin. A weak chin, it's not a good thing for a male. So not so much as the female. The female's more concerned, I think, with the eyes and the rosy cheeks.
Okay. Our next question is from Justine. She wants to know what the best treatment for tired under eyes. We get so many questions on eyes.
That's another common searched area for treatment. This sort of area here underneath the eyes, sometimes they'll be called the tear trough. If you have a deep depression or you have a lot of sagginess around the eyes, it makes you tired as well. But the treatments really that you're going to be looking at there are fillers, but in a deep plane, polynucleotides on a more superficial level, perhaps more for the skin, Botox around the eyes here, but not too much in here because Botox can actually make things worse. It can actually create eye bags. So there are a variety of treatments, and it's coming down to a good assessment. It will differ between the ages and it will differ between the sexes as to what you choose to do.
Well, what about if one of your new patients came to see you and she's really upset about the condition of her eyes?
Mm.
Would you say, I'm sorry, but I really can't do anything with injectables. What you really need is surgery.
That's very true. And I think that most experienced practitioners realize that there's a limit to what they can achieve. And this certainly happens as we get older, trying to lift tissue, trying to treat, particularly around the eyes, this area here where we get a lot of loose skin. At some point, you're going to have to say, listen, I can't achieve the result that you want or the outcome that you want. And you really need to think about a surgical option. So then we're going to be looking at upper or lower blepharoplasty in most of those cases.
Okay, good. Our next question is from Amy. She's 66 years old. She's been getting Botox since she was 36. Is getting Botox safe long term?
So I have a lot of patients that are been with me 20 years or so they are aging with me. What I find is that Botox is safe, but we tend to use less of it. We're not using so much Botox in the forehead. We're not using so much around the eyes. The one area that I still use the Botox in an older patient is here, this glabellar region. And really, for me and for them, it's about lifting. It's not about the wrinkles. It's not about the folds. It's about lift, because we get a lot of heaviness or brow ptosis as we get older. We get more wrinkles in these areas that I mentioned, and it's not just about the muscles. And you have to remember that Botox works at the muscular level. There are other things that are going on that cause the wrinkles, such as loss of skin elasticity, a loss of volume in the fat layers. And so you need to think about how you're going to address these. Botox, in fact, as you get older, can make things worse. A lot of people think more wrinkles, more Botox, but the actual muscles are becoming weaker. So if anything, it's the reverse. It's, as you get older, less Botox. In terms of safety, I think it's very safe. There's no studies to say it isn't safe. I just think you have to be cautious about how much you're using as you get older with Botox.
Okay, thank you.
Yeah.
That's it.
Well, thanks very much. If you do have any other questions, please go to my website and submit them there. Thank you.